Well, good afternoon. Before I begin with today's COVID-19 update, I'd like to begin by congratulating all of those elected to municipal councils across Alberta yesterday. Thank you to the hundreds of candidates and their teams for putting themselves forward for public service and for playing a vital role in our democratic system. I look forward to working with Alberta's newly elected and re-elected local leaders as we address the challenge of COVID-19 and of economic recovery, as well as building a strong Alberta for the future. In particular, I'd like to congratulate Jyoti Gontek on her election as Mayor of Calgary and Amarjeet Sohi on his election as Mayor of Edmonton, Alberta's two great metropolitan cities. I spoke with both of them today to offer my best wishes and to extend a hand of cooperation and collaboration. There will always be some differences of view and interest between different orders of government, but Albertans rightly expect their elected leadership to work together constructively. I look forward to reaching out to many other mayors elected last night with the same message. And this is the message: let's row together in the same direction towards job creation and economic growth. I'm encouraged by preliminary results of the referendum on equalization, which suggest that Albertans do want a fair deal, but I will await the final results that will be revealed by Elections Alberta next week before commenting further. Finally, I'd like to thank those who stepped forward to run in the election of Alberta's for Alberta's nominees for the Senate of Canada. While final results won't be released until next week, it's clear that hundreds of thousands of Albertans want Alberta's representatives in the Senate to be chosen by Albertans, a message that I will once again convey to the Prime Minister. Turning to today's update on COVID-19, I would like to thank Albertans for all that they have done to push down the fourth wave. Of course, the biggest thank you goes to Alberta's amazing frontline healthcare workers. Now, AHS has been able to add up to 203 ICU spaces across the province to care for those in urgent need. This more than doubled the number of ICU beds available. And this helped care for those who needed it and prevented our hospitals from being overwhelmed. We also declared a state of public health emergency and put new rules in place to slow COVID transmission. We also implemented, as you know, the restriction exemption program, the proof of vaccination program, allowing eligible businesses to continue operating beyond the restrictions as long as they require proof of vaccination or proof of a negative privately purchased COVID-19 test. These were all tough but necessary steps in response to the crisis that we were facing 3 and 4 weeks ago. On September 15th, I told Albertans that how bad the situation becomes and how long it lasts is up to each and every one of us. And Albertans have risen to the challenge. Right now, our ICUs are at 75% capacity, down from 97% just over 6 weeks ago. Today, there are 964 people in hospital with COVID-19, a 15% decline from the peak of this fourth wave on September 27th. COVID ICU patients have declined slightly as well. Today, there are 11,400 active cases across Alberta. This is nearly 10,000 fewer than at the peak on September 26th, and similar to the number that we had on August 29th. Our daily case counts, our positivity rate, and other metrics are falling too. Earlier this month, I asked Albertans to go the extra mile on Thanksgiving weekend. We had seen in past long weekends lead to a jump in cases and couldn't risk it happening with our healthcare system already under enormous pressure. I asked that we show thanks to our healthcare workers by following public health guidelines because we owe it to them to do all that we can to reduce the pressure that they face in our hospitals every day. It's been over a week since that long weekend, and I'm pleased to say that so far we have not seen evidence of a Thanksgiving spike in cases, although we need to keep watching over the next few days as it's a little too early to see completely the full impact. The reproductive rate, or the R value, for the province last week was, we estimate, 0.85. As all of this is good news, but we still have a long way to go. We continue to identify hundreds of new cases every day, and cases could rise sharply if Albertans stop following the current public health measures in place. There are still more COVID patients in hospital today than during the peak of any other wave. It'll take many weeks for this to decline significantly, and Alberta Health Services has thousands of postponed surgeries that it will need to resume as soon as possible. Winter also means that flu season and more time spent indoors, which will make it easier for this virus to spread. So today, I'm asking all Albertans to keep doing your part to ensure COVID case numbers continue to decline throughout the fall. That means following public health guidelines and being safe. It means getting vaccinated as soon as possible if you're not already, so you can protect yourself, your family, your loved ones, and our healthcare system. I'd also like to remind Albertans that you can now head to a pharmacy or book online to sign up to get your influenza flu vaccination shot. This is critically important because often and during flu season, we'll end up with additional pressure on our hospitals. We can't afford that right now. Participating pharmacies are now involved, and they're making available drop-in shots as well. Getting your flu vaccination will help to stop the spread of flu influenza, reduce flu-related hospitalizations, and help our healthcare system provide care to those who urgently need it. Friends, we see if COVID cases are continuing to decline, but we need to stay on top of this. This is an ever-changing and deadly enemy that we are facing, particularly for older Albertans and vulnerable people with underlying health conditions. But thanks to vaccines, outbreaks and deaths at continuing care facilities are far below levels seen during the earlier waves. But even with this added protection, these residents at continuing care facilities, for example, remain most at risk. That is why, effective October 25th, new rules to protect residents and staff in continuing care facilities across the province will come into force. Dr. Hinshaw will provide the details in a moment, but all visitors will be required to wear masks, and stronger quarantine requirements will apply to prevent new or returning residents from bringing the virus into these facilities. We are still dealing with a crisis among the under-vaccinated. About 90%, an overwhelming majority of the COVID patients in ICU are not fully immunized. This fall, we have seen a surge in vaccinations as Alberta is closing the vaccine gap with the rest of Canada. As of today, 86.1% of eligible Albertans have received at least one dose, and 77.6% are fully vaccinated. More than 700,000 doses of vaccine have been administered province-wide since we launched new measures to encourage Albertans to get the jab. Like, for example, the $100 vaccine incentive and the restrictions exemption program last month. I'd encourage everyone to get that vaccine if they haven't yet done so, but also to download the QR code as soon as possible for the restriction exemption program. It's easy to do. All you need to do is go to your Alberta Healthcare, you need your Alberta Healthcare number and enter that into the website. As of November 15th, the enhanced record with a QR code will be the only valid proof of vaccination to access businesses and organizations participating in the REP. Albertans who can't access the QR code on a smartphone would be able to print it out, or if you need to have us help with that, you can go to any Alberta Registry office to print out the QR code. And so with that, I just want to say once again that to thank Albertans for the progress that we have made over recent weeks. We have more work to do to protect our hospitals and our healthcare system. With that, I will turn it over to Dr. Hinshaw with today's update. I believe we'll also be hearing from Dr. Verna Yu, and I'm also here with Minister of Municipal Affairs McIver if there are questions coming out of yesterday's municipal election.
Thank you, Premier, and good afternoon, everyone. Before I get to today's numbers, I would like to clarify a small point about the different types of valid proof of vaccination accepted under the Restrictions Exemption Program. I want to remind all businesses and organizations participating in the program that proof of vaccination from out of province, military, or First Nations health clinics are valid for entry. They may look a little different from Government of Alberta documentation, but they are acceptable options. Turning to today's numbers, over the last 24 hours, we identified 531 new cases of COVID-19 and completed about 8,000 tests. Our positivity rate was about 6.7%. There are currently active alerts or outbreaks in 315 schools. Of these, 4 schools are on outbreak with 10 or more COVID cases who attended school in the last 14 days while infectious. As the Premier noted, we continue to see a modest decline in hospitalizations. There are currently 964 people being treated for COVID-19 in hospital, including 218 in the ICU. Pressure is easing a little on our healthcare system, but we still have a long way to go. Sadly, over the last 24 hours, 12 new deaths were reported to Alberta Health. My deepest sympathies are with the family and loved ones of these individuals and anyone else who has lost someone they cared about to any cause. As the Premier announced, we are making some updates to help reduce the risk of transmission in continuing care facilities. I'd like to explain a few more details about these changes. Starting on Monday, all visitors will be required to wear a mask in all indoor areas of the building, including in residence rooms. This applies to all visitors, whether they are unvaccinated or partially or fully vaccinated. The only exception will be in cases where there are significant communication challenges, such as a resident being hard of hearing or an individual with dementia. If you feel your mask will limit your ability to communicate with your loved one, please reach out to your site operator to discuss this. The second change relates to quarantining and testing. We want to make it harder for the virus to enter these facilities. To increase protection, all long-term care and designated supportive living residents, regardless of their vaccination status, must be quarantined temporarily when being admitted to a facility from acute care or returning from a hospital stay that was longer than 24 hours. This quarantine will last only until they receive a negative PCR test. While this quarantine period is expected to only be a few days long, while awaiting test results, I know this can be very difficult for residents and families. This is intended to help prevent the virus from entering these facilities, where we know it can possibly spread quickly and put many at risk. I will also be sending a letter out strongly encouraging families and friends who were not fully vaccinated to not visit or attend to residents in person. I know this will impact residents in different ways, but it is very important to help protect residents and staff from COVID-19. Fully vaccinated Albertans who have no signs of illness can continue to see their loved ones who are residents in these facilities as often as they wish. While this is a recommendation, in the letter I will also reinforce that operators have the authority to implement additional mandatory measures in their facilities as appropriate in consultation with their residents and families. This could include requirements for proof of vaccination or rapid testing for visitors entering the site. Operators have worked incredibly hard throughout this pandemic, and their goal is always to protect the health of our loved ones who live in these facilities. It is essential that all visitors to continuing care facilities follow all rules in place, whether set provincially or locally. It's been a long and hard pandemic for everyone, but especially for continuing care facility residents, operators, staff, and visitors. I want to thank you all once again for adapting and following these new requirements to keep our most vulnerable Albertans safe. These changes come into effect on Monday, October 25th, and they are necessary to help protect our most vulnerable Albertans who are still at risk. I'd like to end today by thanking everyone who continues to do their part to bend the curve down in Alberta by following the health measures in place and looking for ways to limit in-person interactions. Our collective efforts are making a difference. Let's keep it up, continuing to ease the pressure on our healthcare system so all Albertans can receive the care they need for any health issue. I'll now pass it on to Dr. Yu for an update on the health system.
Good afternoon. As Premier Kenney mentioned, we continue to see pressures on our healthcare system ease ever so slightly. This is obviously good news, and we are extremely grateful to everyone who has helped us by following the public health restrictions and getting immunized as quickly as possible. It sounds simple, but it works. By staying home when feeling unwell, by limiting gatherings, and by protecting yourself and others by getting vaccinated, you're helping to reduce the strain on the healthcare system. And that means more available beds for people who need hospital and ICU care, and some deserved respite for our frontline healthcare teams. As of this afternoon, as you've heard, we have 376 general adult ICU beds in the province, with 75% of those occupied by someone needing critical care. And without the additional 203 surge spaces, we would be at 163% occupancy. While we have seen the number of COVID patients in ICU come down over the past couple of weeks, we continue to see high numbers of Albertans need ICU care for non-COVID reasons. This is partly due to our decision to carefully increase the number of surgeries that our teams are performing each week. More surgeries means more patients needing intensive care post-op. This is what our system is designed for, and as pressures created by COVID decrease, we are able to use more of our ICU beds for their intended purpose. More surgeries also means having surgical staff and anesthetists return to the operating rooms and post-anesthetic recovery rooms to care for patients who need surgery. So I cannot say thank you enough to the surgical teams who are redeployed to help in our ICUs during a time of great need. It is a positive sign that we are now able to start redeploying them back for surgical care. This means that in turn, we will be reducing the number of beds we specifically have in our ICU surge capacity incrementally in the coming weeks. For the past 2 weeks, we have been performing any urgent surgery that had to be completed within a 28-day window. We are now gradually increasing that volume so that our teams can perform urgent surgeries that needs to be done within a 42-day window. It's a fine balance, and we must ensure that we have adequate ICU capacity should COVID numbers increase again. We have not yet seen the potential full impact from Thanksgiving long weekend 9 days ago. We must also recognize that many Albertans have had their surgeries and procedures delayed over the past 2 months, and we need to look after those people as soon as we possibly can. As we have seen during previous waves, our surgical wait list grows quickly when we have to repurpose ICU beds to care for COVID patients. So it's imperative that we return to normal surgical volumes as soon as capacity allows. We will ensure that we maintain ICU capacity above daily demand to the maximum we can, given available staff and physicians, and a return to more usual levels of surgical care. And we will ensure that we remain nimble enough so that we can readjust our plans as needed if COVID cases rise on an urgent basis. We're doing this cautiously and carefully because the situation remains very serious. To those Albertans who've had their surgeries or procedures delayed, we are committed to rescheduling you as quickly as possible, provided we have the capacity to do so. We understand your anxiety and your frustrations, and we know that this has been a very difficult and challenging time. I would also like to talk briefly about our mandatory vaccination policy, which we announced in August, just as the fourth wave was starting. As of this morning, approximately 92% of our full-time and part-time AHS employees have submitted proof of having 2 doses of COVID-19 vaccinations. Approximately 92% of physicians working in AHS have done the same, and more than 97% of our ICU staff are fully immunized. 7% of our staff have yet to submit their proof of vaccination, and we're actively working to confirm their vaccination status. Less than 1% of our staff and physicians are seeking an accommodation under the policy. So overall, this tells us that there's very broad support for the mandatory vaccine policy. These are impressive numbers, and we're extremely grateful to all of those who have submitted their proof of vaccination. We stand by the policy, and it will be fully implemented. This vaccine requirement is essential to ensure the safety of our people, the patients, and vulnerable Albertans. And the numbers show that the vast majority of healthcare workers are fully immunized. As mentioned, only a small minority are seeking an accommodation under the immunization policy, and as of this morning, we have received about 1,200 requests for accommodation on medical or religious grounds, with about 830 having submitted the required paperwork to allow for full evaluation of their accommodation request. That's less than 1% of our staff, physicians, and midwives. Accommodations to the AHS policy will be made for medical or religious reasons, except where a workplace accommodation is approved. Those employees who are not fully immunized in compliance with the policy will be placed on an unpaid leave of absence. With such low numbers, we don't anticipate the policy having any significant impact on our ability to provide care to Albertans. We've also been tracking resignations specific to the implementation of the vaccination policy. To date, 61 employees have resigned, including 31 in clinical roles, of which 11 are registered nurses. AHS strongly encourages those staff who remain unimmunized to get their immunization as soon as they can and to address any concerns they may have with their leader or healthcare provider. We will continue to talk with our employees, to answer their questions, and to urge them to get immunized if they haven't already done so. The vaccines are safe and are our most effective tool in reducing transmission of the virus, protecting ourselves, and protecting our loved ones. This extends to all Albertans. If you have any questions at all about the vaccines, their effectiveness or their safety, please reach out to a healthcare professional or call 811. So thank you for your attention.
Thank you, Dr. Yu. We'll now move over to our media Q&A. Just a reminder to folks to please identify the news outlet you're with and your name as you queue up at the microphone to ask a question. And just a reminder as well that we have, in addition to Premier Kenney and Drs. Yu and Hinshaw, that we also have Municipal Affairs Minister Rick McIver available as well. As I see that we only have one in-person question today, that's Michelle Bellefontaine in Edmonton. You can go right ahead, Michelle.
Hi, I have a question for Premier Kenney. Hi, Premier. This is a couple of questions from one of my colleagues about the equalization referendum. Preliminary equalization referendum results from some municipalities show some regional differences. For instance, 69% of people in Medicine Hat and Grand Prairie voted yes, compared to 53% in St. Albert. When all the votes are counted, what value of yes vote would you consider to be a strong mandate to compel further action from your government, and why?
Well, we're looking for a majority to say yes to a fair deal. This is a commitment we gave Albertans in the last election to let them speak to the issue of equalization, to give this province leverage in fighting for a fair deal with that and other transfer programs. And I'm going to wait to see what the final results are. I understand that based on the current preliminary results, it's about around 60% having voted yes, but we do want to wait until all of the votes are counted before commenting further. If we do see that endorsement of the referendum, we would then move forward with a motion in the legislature when it resumes later this month to ratify this request for a constitutional amendment, and then, of course, move forward with Ottawa on those negotiations.
And Michelle, do you have a follow-up?
Yeah, another follow-up from my colleague. If you look at the daylight savings time results from Calgary, St. Albert, and Strathcona County, the no vote is leading in these urban areas. So how much of a surprise is this result to you, given the overwhelming sentiment in favor of DST on your government survey last year?
Well, again, on this one, we'll wait to see what the final results are. I would note that back in 1967, there was a referendum on a very similar question about daylight savings time, and it was 49% who voted in favor, 51% who voted against. So it may well be that 5 decades later, Albertans are just as split on this question as they were a couple of generations ago. So I know we'll wait and see what the final results are and respect that. This is why we put it to a vote, because, you know, having an informal survey, which can be it can be an avenue for people to provide input. It's not a real accurate and formal way of doing a public consultation. So there have been people, many people Albertans asking government for years to stop changing the clock. And we see jurisdictions all around us doing just that. British Columbia has made a decision to stick with DST. Yukon, Alaska, Idaho, Montana, Oregon, and California. So many of the jurisdictions, and of course Saskatchewan next door, has never changed their clock. So the government thought that Albertans should have a chance to speak to this, given that so many of our neighbors in this part of North America will be moving to the same clock year round, and we'll wait to see what the final results are.
Okay, thank you, Premier. That wraps up our in-person questions, so we'll hop over to the phones. Operator, can you please put through our first caller?
Thank you, Brianna Karsten Smith, Global News.
Thank you. Hi, Premier. I also wanted to ask you about last night's election, specifically what the results mean for you and your party, because, you know, it's one thing when we see cities like Edmonton and Calgary go progressive, but it's another when we see a place like Medicine Hat go more progressive and kick out an incumbent. We saw a lot of support, or maybe not as much support for the Conservatives federally a few weeks ago as we may have expected in Alberta. So what we're appearing to see is more Albertans go more progressive. What does this mean for you as you face an election in less than 2 years?
Well, I'm not sure how you define progressive, and municipal elections are on a whole different range of issues. I generally don't think municipal elections are on, as you're suggesting, ideological issues. I think municipal elections are generally on very practical issues, and they're very local. They're based on often the folks who succeed are the ones who put in a lot of work to visit their neighbors and communicate and reflect local priorities. So I congratulate all of those who were elected last night across the province and across the political spectrum, regardless of their views. I think it's important for us to avoid turning municipal politics into a partisan exercise. And again, I respect the choices that voters make. I'll work with, our government will work with all of the mayors and councillors elected to try to move in the same direction, obviously in addressing the COVID crisis, but an economic growth and recovery emerging from it. So you can pick out different results across the province. I suppose the bottom line is voters have made their choice. We'll work with those who are elected. And once again, I'd like to thank all candidates who ran. I also want to thank the hundreds of thousands of Albertans who took the time to vote in the referendums on equalization, as well as DST, and of course in the Senate elections. And we look forward to the final results on those. And by the way, you mentioned the federal election. If I'm not mistaken, the federal Conservative Party just won over 90% of the federal constituencies in Alberta with a strong majority of the vote province-wide. And I respect that outcome as well.
And Brianna, do you have a follow-up?
Sure. And if I'm not mistaken, there are 4 progressive MPs now in Alberta, which is more than there were prior to the federal election. And, you know, you say that municipal politics aren't about party politics, and I understand that, but we had a mayoral candidate in Edmonton who ran for nomination for your party. We had a press secretary from your government running in this election in Edmonton. We had several candidates linked to your party or who received support from your party. So I'll ask you again, what does this mean for your party when people who either support you or were supported by your party lost?
Well, you're just factually inaccurate there. So I'd ask you to go back and not report something that is untrue. The United Conservative Party was not involved in supporting candidates. I gather that the NDP was, as they typically do in municipal elections, very involved, sharing their lists, etc. That was not the case in the United Conservative Party. We respect the independence and the nonpartisan nature of municipal elections. Of course, people across the spectrum who may have different partisan affiliations may choose to run, and they have every right to do so in our democracy. But the party that I lead was not involved in intervening directly or indirectly in the municipal elections, and you'll have to ask the NDP about why they chose to do so.
Okay, operator, can you please put through our next caller?
James Keller, Globe and Mail.
Hi there, this is a question for the Premier. In Calgary, Jyoti Gondek, the mayor-elect, said that she would be open to trying to work with the federal government to get a child care deal for the city, essentially trying to bypass the provincial government. What do you think of that?
Well, we are in advanced negotiations being led by Children's Services Minister Rebecca Schultz with the Government of Canada. As you know, we believe that Alberta deserves at least the same kind of choice and flexibility that the federal government gave to the province of Quebec. Albertans, I think, have spoken fairly clearly yesterday about their desire for a fair deal in the Federation, and that fairness should apply to any childcare arrangements as well. So Minister Schultz tells me as recently as a couple of hours ago that those discussions are going well, and she'd be happy to sit down with the mayor-elect here in Calgary and other municipal leaders to take on board their views and hear their priorities when it comes to childcare as well as other issues.
And your follow-up, James?
Yeah, I'm not sure if this one is for the Premier or for Minister McIver. One issue that Jyoti Gondek had talked about is asking the province to reform how cities are able to raise money through property taxes. And she also wants the province to let the city keep a large share of those property taxes. So I'm just wondering what the government thinks of those ideas, and are you open to either of those proposals?
Well, I'll be happy to sit down and meet with Mayor-elect Gondek, and we had a good brief call today where I had a chance to congratulate her, and as well as a call with Mayor-elect Sohi in Edmonton. And I expressed to both of them, I hope that we'll be able to sit down and have our first formal meeting once they're sworn in and have things in place. So looking forward to that and hearing their priorities and about their platforms, how those issues may interface with the government of Alberta. I hope that we can find a collaborative and positive working relationship. When it comes to property taxes, I'll hear what they have to say, of course, but this government has not made any changes to the longstanding fiscal arrangements between municipalities. So I don't think there's anything that we've done which could have provoked a negative response. And I would just point out, if this is about the issue of the share of property tax revenues, the province's share of the total provincial and municipal property tax revenue has fallen from 51% back in 1994 to 25% in 2019, while at the same time the share of education operating costs covered by the education property tax was about 30% in 2020 compared to 51% in 1994 when the present system was established. So municipalities are actually generating a significantly larger share of revenue from that taxation source than was the case in the past. And there have been no significant reductions in provincial operating grants to municipalities under our government, despite the fiscal crisis that we have been facing. And we've continued to provide record high levels of municipal capital grants, infrastructure grants. So Now, it is true. It is true that those grants will begin to taper off because they were increased in part to address the recession. But be happy to sit down and take on board any constructive suggestions that either of those new mayors have for us.
Okay, operator, can you please put through our next caller?
Don Brave, Calgary Herald.
Premier, Mayor-elect Gondek today asked the province for help in getting Sean Chu, the councillor who was elected by 52 votes yesterday, off of council because she believes he should be off council. He should be resigned because of the scandal that's erupted over past actions when he was a police officer. How do you feel about Councillor Chu, what you've been seeing and reading about what happened, and would the province be willing to take action should he not resign voluntarily, as the mayor is suggesting, mayor-elect is suggesting? Would you kick him out because the province could find a way to do that, surely?
Thanks for the question, Don. First of all, let me say that sexual impropriety with a minor is appalling, but especially if that misconduct comes from somebody in a position of power, like a police officer. And so this is a very serious matter. I understand that these incidents occurred 23 years ago, and I don't have all of the facts in front of me. But clearly there are serious issues that need to be answered fully and transparently about what happened, about what legal, criminal or disciplinary measures were taken. And if there was a failure in the system, we need to know what that was. So I think it's important, because this is a potential matter that could come back before the courts, it's a potential legal matter, to get all of the facts. I'm not, in our initial review, I've been in cabinet meetings all day, Don, but I've just been given an initial briefing that the provincial government does not have the authority under the existing law, under the Municipal Government Act. The minister does not have simple authority or power to dismiss locally elected councillors. There are enumerated grounds for doing so, including violations of various sections of the criminal code. So we are looking at all of that. I will add that I sat in a federal caucus many years ago where a member was a former police officer who had become an MP, was convicted of sexual impropriety towards a minor while he was an officer of the RCMP. And we immediately removed that individual from our caucus, and eventually, of course, he left Parliament. So to me, there are few crimes worse than sexual exploitation of a minor, and I take this very seriously. I'd be happy to further discuss this with the mayor-elect, but we also need to get all of the facts and see whether there are any, whether there's anything that the province can do to address the situation.
Okay, Donna, do you have a follow-up?
Yeah, so what would it take then? What would you need to see before you would agree to find some way? I'm sure that a cabinet order, an order in council or something like that might do the job. Would be very unusual because that really isn't in the list of things that can get a councillor booted out in the Municipal Government Act. But then there's the criminal code. Do you need to see some criminal evidence or something like that before you would consider doing that? Should he not resign?
Again, Don, what I've been told, and we're just getting reviewing this whole situation. I've been briefed that councillors, municipal councillors convicted of an offence punishable by at least 5 years in prison, or an offence under sections 123, 124, 125 of the criminal code, are automatically disqualified from running under the Local Authorities Election Act, but that the Minister of Municipal Affairs does not have the simple authority or power to dismiss locally elected councillors. But I've asked our Minister of Municipal Affairs, Rick McIver, who's with me here today, to get more detailed legal advice on this and see if, first of all, we can get all of the facts in front of us. But as I say, we will see if there are any authorities that we have to deal with a situation like this, because any sexual abuse of a minor, particularly for somebody in a position of authority, is something that none of us can accept.
Thank you, Premier. Operator, can you please put through our last caller who's queued up?
Rick Bell, Calgary Sun.
Good afternoon, Premier and Minister McIver. I'm just going to follow up with Don Braid's question. So you've identified and you've discussed the legal matter. Do you think, though, independent of those legal investigations you're doing, do you think Sean Chu, for the good of one and all, should resign today, right now, right here? Apart from whatever your authority is or isn't, do you think Sean Chu should take himself off council now?
If these reports are true, and I've only had a summary of some of the news reports on this, but clearly there's I gather a bunch of legal proceedings that are sealed from 23 years ago. And I think the very least, I mean, if he's denying these claims, then he owes the public proof of that denial. And so if these claims are true and these revelations are correct, then I think it would be the honorable thing to step aside. Yes, absolutely.
And Rick, do you have a follow-up?
Yes. I'd actually like to address this to Minister McIver, because he's very familiar with Calgary City Council, having been on council for several years. Minister McIver, do you think, from what you've read and what you've seen, do you think that it has met the bar of having a person voluntarily resigning, and especially given your experience as a Calgary, I'm a member of Calgary City Council for several years. Do you think this, from what all the news reports say, do you think that this meets the bar where a person should resign? Not further information, not sealed records, right now should resign, given your experience.
Well, thanks, Rick. And let me say this. I would agree with what the Premier said. If the worst of the allegations turn out to be true, then yes, he should resign. But we still need to do our due diligence and find out what the facts are. But direct answer to your question is, if the worst of the accusations are true, then yes.
Okay, that wraps up our media availability today. Thanks so much for joining us.